I'm Emily Mashak, and you are listening to Tuned In to NoCo, Town Square Media's show that lets you know what matters in NoCo. I'm talking today with Dr. James Teumer about some issues that COVID-19 is creating with the emergency room at UC Health. So thank you for joining me today, Doctor.
Oh, it's my pleasure.
Before we launch into that, though, would you mind just introducing yourself for everyone? How did you get to where you are today?
Well, I grew up in Fort Collins, and I've had the pleasure of coming back here and working. I've been an emergency room physician here for 28 years. And like I said, having grown up here, it was always my job to come back here and work and do what I do. And I've been blessed with that opportunity.
That's awesome. Obviously, COVID-19 has changed things for everyone, but especially healthcare workers. And I want to thank you first just for being on the front line and doing all that you're doing during this pandemic. I really appreciate that. I'm sure we all do.
Well, thank you very much. We've gotten so much outpouring of gratitude that it's unbelievable. I mean, this is what we do. This is what we want to do. This is what we love to do. And people are thanking us for something we're already having the pleasure of doing. So it's been amazing the type of support that we've gotten.
That is great. Now, I know we're going to delve a little bit into how it's affecting the emergency room, but on a more general path, can you just explain from a healthcare worker's perspective how the whirlwind of COVID-19 has affected you?
Oh, it's affected us in a variety of ways, some that we expected and some that we didn't expect. I think that number one is that we were expecting certain things. And so now we go to work every day, we wear a mask. When we go in to see certain patients, not only do we mask, but we put on full protective gear. The other part of it is that it has made us appreciate certain things, the abilities to prepare for these type of things again, because they occur every 3 or 4 years and it kind of gets refreshed in your mind. The most unique thing about it, I'd have to admit, is that our census has gone down considerably because of this. And part of that is because people, I'm sure, are social distancing, but people are afraid also to come in. I've never seen in my 28 years our census go backwards. And it has truly gone backwards with this. And so when we see people, we're seeing less of them. And then we're seeing truly very sick people that are still coming in. And that's basically all we're seeing right now. And it's changed things in a very unique fashion. I've been through AIDS, I've been through SARS, I've been through Ebola, and now I've been through this. And they've all had their unique characteristics, but nothing has made us go backwards census-wise like this.
Would you say that's the biggest difference you've seen between COVID-19 and the other pandemics?
No, I think the one thing about COVID-19 is the sheer number of people that have contracted the disease. When AIDS came out, far less people contracted the disease, but we had a 100% mortality rate for basically like the first year because we couldn't figure out what we were dealing with. COVID-19 is different in that so many more people are getting it, but the mortality rates, the percentages are less. And so it's been unique in that fashion that so many people can contract this virus, unlike anything we've ever seen before.
Mm-hmm. Now, you mentioned that you're seeing a lot less people, and part of that we talked about. The reason for this call is because people are afraid to come into hospitals for fear of getting COVID-19. Can you just tell me more about why this is such an issue and what's really going on?
Well, I understand the fear of catching the disease and going out in public, and I'm sure that's part of the social distancing concept. But people need to understand is, number one is that we are very good at isolating people with COVID or COVID-19 or potential COVID-19 from the rest of the population when they come in. From the minute you walk in the door, the isolation process starts on. We mask people. We put people that don't have symptoms consistent with it. If you came in with a heart attack, you're going to go to a completely separate area than one that if we think that you possibly have COVID-19. So we mask, when you come in the emergency department, you go a certain direction to avoid certain areas. We have all the people that we really are worried about having the illness, the COVID-19, into what we call negative pressure rooms, which are rooms that keeps the virus in the room, and so it doesn't allow it to spread from outside of there. And then the general public is on a different area, and they're not exposed to any of this stuff. You have a better chance of catching coronavirus or COVID-19 by going out to the general public, whether it be the grocery store or whatever the case may be, is than to catch it from us. And so I think that people, as a result of this fear, are not coming to the emergency department when they should be coming to the emergency department. I tell people, is anything you would have come to see us before, you should come now. Because if you're waiting, you're putting off the ability for us to treat what's wrong with you. And in some cases, it's very devastating because time, we like to say time is tissue on certain things, whether it's heart attacks, strokes, whether it's your appendicitis, which is now ruptured, you name it. These are the things that we should have gotten to a lot sooner, and we're not.
Right. So people really are waiting too long to come in for fear of either catching the disease or overwhelming hospitals.
Correct. They are definitely afraid of coming to see us because of that, and they shouldn't be. We will protect them. We protect ourselves. We do an excellent job of isolation. We do an excellent job of protecting not only ourselves so that we don't go from room to room and spread it, also from protecting your patients from each other. And so whether you're in the hospital, whether you're in the emergency department, whatever the case may be, is we've taken all those necessary steps to protect every single aspect of the patient, the staff, and the process itself.
Right. Now, I want to ask, because I've seen things not necessarily from medical professionals, but there's just so much information going on. And a lot of people say that if you feel ill, but it isn't an emergency, then you should stay home and you shouldn't go in. And I think a lot of people with everything that's going on have sometimes trouble discerning whether it is an emergency enough to go in. What would you say to people who are kind of confused about that?
Well, I'd have to tell you this, is that if you think if it's running through your mind that you have an emergency or you really need to be seen, you should go be seen for two reasons. One is to make sure it isn't, and two is I think the peace of mind of knowing that you do or don't have something and getting it taken care of you can't measure what that does for you. And so I think that people need to do that. If you have a primary care physician, you can call them and see what they recommend. They talk about virtual medicine and doing the telemedicine visits. Those are a reasonable screening tool, although more times than not, they're going to be able to tell you that we cannot figure this out. You should go to the emergency room. People shouldn't hesitate if they really think that they have something of any significance, because the only way you're going to find out is to come see us.
Right. And it is A-okay to come see you no matter what, despite what people think or have been hearing online.
Oh, absolutely. Like I said, we're very good at the isolation and the protection process of everything and everybody. And I think it's very safe to come see us. As I said before, you have a higher chance of catching it in other places than you do in the emergency room or in the hospital.
Right, right. Now, I know a lot of people are scared of catching it, and we have cleared that up, that it is totally safe to go to the hospital if you need to. In terms of people worrying about overwhelming healthcare workers, obviously you are here for the people and you want to help anyone in an emergency. But can you just touch on a little bit how healthcare workers are doing? I know you're feeling overwhelmed. What is that like?
It's very unique in the sense that we see some things that we don't normally see and can be pretty emotional. The staff has done an excellent job. Our nurses, our techs, our medics, our docs, our PAs have had such a great attitude with this. They've accepted it as a challenge. They function so well as a teamwork. We have everything we need to do our jobs, whether it's PPE or other resources. And they've really, as always, they bond together and they have taken on this head on. They like the challenge. They're probably frustrated with wearing a mask all day long because it does get to wear on your face and is a little uncomfortable at times. But short of that, their attitude has been phenomenal. I couldn't be prouder of the staff that I work with and the job that they have done. And then to receive all the appreciation that we have. They've handled the really difficult cases very well. There's nothing sadder than admit someone to the hospital knowing that there's a chance they may never come out alive because of how sick they are. and yet no one can go visit them. They struggle with those type of issues, but they're very good at bouncing things off of each other and with us to maintain that good attitude. And they've just done so well. I couldn't be prouder of them.
That is so awesome. And again, I just want to thank you and all the workers for all that they're doing. And I know the public and our listeners feel the same way. Is there anything that we can do to show our appreciation or to help our healthcare workers out in this time?
I just think that what they have done so far has been amazing. I mean, people have made a point of feeding us. People have made a point of welcoming us and various things. We receive, they talk about that various countries, whether it's you clap at 8 o'clock, you howl at 8 o'clock, all these little things that they've done for us have been great. I think that to support us in any other way, I think the one thing that still frustrates the staff is we're not seeing the people we should be seeing, and they love to do what they do. And so they want to help everybody. And so I just have to say, come see us because they're so anxious to work.
Definitely, definitely. You mentioned earlier that you're often more likely to be exposed to COVID-19 just by doing something as regular as going to the grocery store. I know we've been told to wear masks and possibly gloves, but I think a lot of people are unsure as exactly how to protect themselves, especially when you hear that some masks don't work or how often you have to wash your masks. What would your advice be just for general protection when you're going out in public? What should we be doing?
Well, that's a great question. The masks serve several purposes. People don't understand is many times the mask is to prevent you from giving something to somebody else as much as it is as for you to contract the disease. Many people are carriers and they don't know it. And so that's one of the benefits of wearing the mask is you might be a carrier, but you're not going to give it to anybody else. I still think that, they talk about wearing gloves. That's great, but washing your hands is probably as important as anything. And we wash our hands a million times at work. I think if you're going to go to the grocery store and bring home groceries, you need to wash your hands when you're done. And I think that if you are wearing your mask and you're washing your hands on a regular basis right now, you're doing everything you possibly can in addition to the social distancing. Respect others when you're out. If you go to, for instance, many stores, whether it's the liquor store, whether it's the grocery store, whatever, they have many of them marked off a 6-foot line to keep that distance while waiting to get to the cash register and stuff. Respect those things and respect other people and do those simple things, and I think we'll be fine.
Definitely. So I do just want to touch on that a little bit more because one thing that I've been hearing is that if you go to the grocery store and you're wearing a mask or gloves, that you immediately, when you go home, you need to wash your mask. And I've even heard that you need to change your clothes and wash those clothes immediately. Is that true, or is that a little bit excessive?
I think that's probably a little bit excessive. When you're out in the open air, the ability to contract the disease is far less than, for instance, in the emergency room in a contained environment. I don't feel like that if I go to the grocery store, I have to wash my clothes or anything else. When I come home from work every day, I wear scrubs in the hospital. I leave them there. As soon as I come home, I'm straight to the shower and take a shower before I do anything else in my house or go greet anybody. But short of that, I don't think in the general public that you have to immediately go home and wash your clothes, take a shower, or do anything else like that.
Right. Now, I know we've been hearing so much about the symptoms of COVID-19 and everything like that. Of course, it's hard to diagnose, and tests are definitely not all around. If you have like a sore throat or a cough, should you be worried, or is that just a common cold? When do you need to really look into if you have COVID-19 or not?
Great question. And many people have gotten very mild cases of this, and it's tough to tell whether it's a common cold or whether it's COVID-19. We often tell people that the biggest things that we get concerned about is the respiratory aspect. If you're really having a fever and you're really short of breath, we're genuinely concerned and you need to get in there. If you're having the other symptoms, especially the GI symptoms, vomiting or diarrhea, and you're getting dehydrated, you need to come see us. If you have the symptoms and you're not all otherwise healthy, in other words, you have any type of underlying health problem, heart disease, lung disease, diabetes, cancer. You're taking certain immune compromising medications, whether it's steroids, whether it's medication for cancer, any of those type of things. If you get any symptoms, you need to be checked out, because the potential to deteriorate is much more, and the potential to get sicker is much more in those situations versus, a 30-year-old who's active and healthy and otherwise has minimal risks for having problems.
Definitely. What else would you like listeners to know right now?
I'd have to say that we're optimistic, that we're hoping that we're plateauing in this disease, in the sense that our greatest fear was running out of ventilators. We haven't done it yet. And we seem to be leveling off a little bit. And the question is, have we plateaued or not? It's too early to say, but I'd have to say that things are looking a lot better now from a number standpoint than we thought they were going to be looking. We've gotten the ability to do a lot more testing. And so we can test you as an outpatient, and you can still go home because you have a mild case. And if we turn and test you and it comes out to be positive, you just have to quarantine then accordingly. And so I'd have to say that I think right now we're optimistic that we are going to get a little bit better each day with this disease, although we still have a ways to go. Well, and the other problem is it's going to come back this fall. It will definitely be back this fall, but we're going to be better prepared for it. Question is, will we have a vaccination for this? The other question, which we don't know, is that if you contract the disease now, does that mean you have immunity from it later on? But we've also come up with various unique ways of treating it. We can get plasma from patients who have had it and developed the antibodies and give it to people to either get them better or to prevent people with cancer with mild symptoms, et cetera, from getting sicker. So we're developing various tactics to fight the disease basically now, and then much more so this fall when it reoccurs.
Definitely. Well, that is reassuring to hear that we'll definitely be better prepared. And just thank you so much, Dr. Teumer, for telling me all this. I know it was very informative for myself, and our listeners will appreciate it. So again, I thank you for all that you're doing on the front line and for taking the time to talk to me. I know this will be really important for people to hear.
Thank you very much. It's my pleasure. We really appreciate everything, and we need the general public to really be educated and understand some things and start getting back out to see us, because it's so sad when you see someone come in with a stroke that we could have done a lot, now we can't. They come in with a heart attack that's completed, whereas we could have intervened and made the percentage of or the amount of damage so much less. People with appendicitis that we normally would have been a simple surgery and go home, now they waited so long it ruptured, they got a 3 or 4 day hospital stay. It's really sad to see those things when normally we would never have seen them.